This is the first of a series of webinars which are focused around educational scholarship put on by ACER, and I'm hoping that this one is kind of going to set the scene and give you some broad strokes, with many of the other sessions are going to be going into more detail. So you should all have received the learning objectives, but just in case, I'm just going to put these up here, let you read them yourselves. You don't need for me to read through these for you. And hopefully we're going to be able to cover all of that material. So if I have one recommendation to you, I would say that try and develop some form of a plan. This is not something I did, so it's kind of the pot calling the kettle black here, but start to develop some kind of an idea of where you want to go in the educational realm, what particular things that I'm going to talk about attract you. Now, when I'm saying develop a plan, at the same time, don't make that plan so rigid that you're not able to take advantage of opportunities as they present themselves to you, which they will with time. Sometimes, you kind of get stuck into these very rigid patterns and you're not flexible enough to say, you know what, that sounds like that might be something really cool, because you never quite know where these things are going to lead. So a career in education is going to involve a number of different facets. It's going to involve developing educational materials, teaching, educational research, mentoring of learners, as well as some form of a service commitment. And quite how these balance out in any one individual career is highly variable, but pretty much any career in education is going to include all of these five. Where do you start? Well, to start to develop as an educator, I would highly recommend you try and find some good mentors. Now, hopefully you're lucky enough and you have somebody who is significantly involved in education within your department. But if you don't, then look outside of your department into the medical school or elsewhere in the institution. I think we often forget that teaching is teaching. Teaching in radiology has some specific areas to radiology, but much of it is much more generalized, and you may have some excellent mentors in your institution and be very happy to show you the ropes, and I've certainly learned an awful lot from many of my clinical colleagues. Additionally, reach out to people such as myself and many of the other members of ACER who have more experience, who are often very happy to guide people on an individual one-on-one session. We'll meet up with you, we'll talk to you on the phone, and so on. Try and go on some educator courses. The AUR has courses with members of ACER, members of APDR, members of AMSER, and so on. Ray has them, RSNA has them. Learn how to be a better educator. Before we get going with some other specifics, I want to address the elephant in the room, and that is promotion and the role of the APT committee or the academic promotion and tenure or academic promotion titles committee. It's called different things at different institutions. Because while this is only one factor in educational scholarship, for most of us, this is where we're trying to go. So I want to think about a couple of questions. So first of all, why would you want to get promoted? Why should we want to get promoted? Well, there is unquestionably some value to the prestige of being promoted, and I don't want to underlay this. You shouldn't feel guilty because you want to become an associate professor or a full professor. Being recognized for what we have done in our area is very important, and these intrinsic motivators to work have been shown to be extremely vital in people progressing along. So it's okay to hey, I've done all this stuff, I want to be promoted. Achieving higher academic stature can raise your stature with national organizations, and it may open up opportunities which might not be available to you at lower academic statures. So when we move into a career in academic radiology, it's really part of the expectation is that you're going to move towards promotion. Generally speaking, you don't come in as an instructor or an assistant professor and just assume that's how you're going to stay, even if reality sometimes gets in the way there. Come back, let me click. There are some funding opportunities which only become available when you're an associate professor, so this may help you with your funding. And if you decide to move institutions, then generally speaking, you'll come into that second institution at the same academic level as you left your prior institution. Very occasionally, you can jump an academic level. Occasionally, you'll move to an institution where they'll say, I'm sorry, your criteria for moving to associate professor at your last institution aren't ours, and we're going to sort of demote you a little. Some institutions which begin with the letter H come to mind here. Not going to say more. And when you come in at a higher academic level, that usually means that you come in at a greater pay grade. Talking of pay, some institutions, unfortunately not mine, give you a pay increase when you get promoted to associate and then full professor. I wish mine did. I know others do, but mine doesn't. But there may be some other either financial or less tangible benefits. So I know of institutions where when you become a full professor, you no longer do call. Alas, also not my institution. Or you get more CME time or more CME money. Alas, also not my institution. So these things are worth looking at. A few institutions do have tenure track positions for clinician educators. There's not a lot of them, and they tend to be on people who are very, very hardcore education, rather clinician educator, but some do. And so tenure is going to give you a sense of security in your job, with, particularly with the vagaries of the job market nowadays. So that's worth looking at. And then there are those institutions where promotion to at least associate, if not full professor with time, is an expectation. And there certainly are some institutions I know of where it is an up and out policy. So after a certain number of years, you are expected to be applying for promotion, and you are expected to get promotion within a certain number of years after that. And so you need to check very carefully if your institution is one such as this. If you don't apply for promotion or you don't get it, then some institutions will make you change tracks. So perhaps you were in a regular academic track and you have to change to a clinical prefix track. They have that at my institution. You, instead of being a assistant professor of radiology, you can become a clinical assistant professor of radiology. Now, what does that mean? My institution, not much. I guess it's a little bit of a loss of face, and if you go to another institution, that may affect what you come in at in some way. And if nothing else, you get to change your business cards, although you will note here, I'm not an MD, actually MBBS, which is a British medical degree, and despite many years, they still can't get them right. So on the other face of the coin, why might you not consider going for promotion? Well, it's a lot of work to do the sort of scholarly activity that you need to do to be able to put yourself in a position to be able to be promoted. And, especially in this era of marked reduction in academic time, it may be that you don't feel that you have the time, or you don't want to spend a lot of the time, which ends up being on your own time, your weekends, your family time, doing that work to put yourself in that position. Doing the promotion application itself is a not insignificant job. You have to do a lot of documentation, you have to get your CV together, somebody in your department, if not you, has to get letters from your referees and so on. So you may just decide that, why bother? I'm not going to earn any more money. I'm just going to kind of hang out here as I am as assistant professor. So, but, I really feel that this should be part of our long-term career goals as academic radiologists. And even if it's not something you can see yourself doing in the next 2 or 3 years, maybe it's going to take you a little bit of a slower course, then you shouldn't lose track of that horizon. The first thing that you need to do, and I would say whether you're considering promotion now or long-term into the future, is you need to review the document that you have that is produced by your APT committee at your institution. All right, these are all going to look a little different. I've seen an awful lot of these over the years. Some of them are much easier to read than others. But what this is going to do is it's going to define the criteria that they use to assess you. And if you don't know what criteria they're going to use, you could have spent a lot of wasted time doing a lot of effort doing things that they don't count. Now, just because they don't list a particular activity in this document as a criteria they look at doesn't mean that they won't pay it any attention. These committees have a lot of leeway, and outside referees also have a lot of leeway at looking at your entire portfolio and saying, okay, well, you know, although you don't mention in your criteria that digital media is counted, you know, this may be something that now that they are looking at. And these documents change with time. A lot of these APT committees are opening up their doors to kind of thinking about things a little bit more in the, let's say, the current millennium than the last millennium. Unfortunately, a lot of these documents, including ours, which has 120 pages, are sort of challenging to decode. And so I would suggest that you use your departmental promotion committee or your chair, if you don't have a departmental promotion committee, to tell you what parts of this document apply to you, because it often covers a lot of scope, a lot of research, investigators, and so on. The next thing you need to find out is what track are you on? Virtually every institution has a number of different tracks which different individuals are going to be on for promotion. Now, you can change tracks quite often later on, but generally speaking, people stay on one specific track. Now, for example, at my medical school, Geisel Medical School at Dartmouth, for the physicians who are part of what's called the academic medical system line, we have 3 different tracks that we could be on. The vast majority of us are on the Clinician-Educator track, but we could also be on the Clinician-Investigator if we do an awful lot more researching, or if you do research and not much clinical, but you teach the Investigator-Educator. These tend to have very specific, very different requirements as to the expectations of an APT committee for promotion. So you need to know where you're going to be aiming. And again, your promotion committee or your chair may be able to help define this for you. We found on a survey that we did of all the medical schools that about 55% of institutions have some form of a clinician-educator track, maybe called something a little bit different. These are the results of, part of the results of a paper which we wrote last year that was published in JCR, where we took apart the APT documents from 30 institutions from different kind of national rankings, and we looked to see what, for the clinician-educator track, did they specifically mention as something that they evaluate. And this is what we came out. And it's kind of interesting because publications, although one kind of think those are sort of going to be most obvious, were actually sort of not mentioned in all of these institutions as being something important. But I think this is sort of gives you a bit of an idea. Yeah, it's important to know that different institutions look at things differently because you may not be spending your entire career at your institution. So keeping your portfolio broad can be helpful. One thing that is clear, however, is that time at rank is not enough. Just because you've been sitting around being an assistant professor and working your guts out clinically and getting a zillion RVUs doesn't mean that you're going to be, for 6 or 7 years, doesn't mean that you're ready to be promoted. You have to document scholarly activity. And for, as I'm going to go through in a minute, while clinical activity is looked at to a degree, it tends to be a minor degree. It's really scholarly activity that they're talking about here. So what is scholarly activity? Well, in most places it's divided into these 4 broad areas: teaching, investigational research, patient care to some degrees, I've said at the moment, and engagement or service. I'm really going to focus on teaching, investigation, and engagement. Patient care here, they're really talking about not just sort of can you churn out the RVUs, but when they're looking at it from a promotions committee, it's going to be more, have you developed a local regional service, for example, that people are referring into you from the outside who wouldn't be otherwise? Have you developed some new protocols and so on? But I'm going to focus on those other areas. Now, these are not mutually exclusive. So there really is significant overlap so that you can be engaged in, have engagement in research, or you can do clinical education and so on. And we look specifically at educational scholarship. Educational scholarship can involve research, engagement or service, and teaching. And again, there is overlap between these different areas. And I'm going to talk about each of these in turn. Now, another definition of scholarly activity is the creation and the dissemination of new knowledge. So note, this is new. It's something that you've created and you've disseminated to others in some means that we'll talk about later that furthers medical knowledge. Okay, so this is their criteria we're using here. Now, the dissemination is the important part. You know, you sit in your office and you develop all these really cool tools, or you do some research and nobody else ever knows about it. It doesn't count. It's got to get out there. It's got to further medical knowledge. And the impact of what you do, both in terms of its impact on the global scheme of medical knowledge, as well as the impact on your portfolio for the promotions committee, depends on how far you distribute it. So as you take it out from being just within an institution to regional, to national, and even to international, that impact is greater. Most institutions expect usually about a 5 or 6 year minimum at a particular rank before you are even eligible for promotion. Now, there are some exceptions to that. It may be that perhaps you did an awful lot of stuff at your last institution, and so you're able to fast track after a lesser time than that. Some institutions, but not all, have renewals at the sort of halfway point. At that point, they may look at what you've done and say, okay, you're continuing okay, we'll keep you on this track. Or they may say, you know, you're not doing enough, we're actually going to think about dipping you to a different sort of track. So they may require documentation of your academic activities before you even get to this point to stay on your rank. So let's look at some very global concepts of promotion from assistant to associate professor in the clinician-educator or the clinician-teacher tract. These are phrased in different ways in from different institutions, and I do quite a lot of outside support letters, and so I get to see quite a lot of these. And this is something very common. They'll say that you have to demonstrate excellence in teaching at any level learners, that you have to have some level of engagement or service either within your institution or externally, that you have to show excellence in clinical care. It's kind of a done deal there. You have to show scholarship that we'll talk about, and that you should have some form of regional recognition through these areas, both engagement, teaching, and so on, and a burgeoning national one. So they're starting to see a few national things on your CV. Now, some other institutions may say something like, you have to show excellence in one of these areas and be engaged in at least 2 others. That's something else I've seen on outside letters. When you move up for promotion to full professor, really the areas are the same. It's just that now they're expecting you to have a national recognition and a burgeoning international recognition. So they're expecting to see a lot of national stuff on your portfolio. Now, a CV is like, you know, an educational portfolio. It's like growing a bonsai tree. You know, this is a slow, incremental process. This is not something that's going to happen overnight. You know, what you don't want to do is kind of wait for 5 years without doing something and then say, oh boy, you know, I'm supposed to be applying for promotion in the next couple of years. You know, what do I need to do? Because it's very difficult to kind of cram all the sort of things that you need to do into the last year. And frankly, promotions committees look very adversely at this, and you know, they're not stupid. And in full disclaimer here, I was a member of the APT committee at Geisel for a couple of years for my sins. It's a really tough job. It's very involved. You know, if they see that somebody's done nothing at institution for 5 years and then suddenly they've joined all these national committees and, you know, sort of going around the country being a visiting professor in multiple places once a month, they look askance on that. They want to see a gradual production of your scholarly activity over the time in the institution. Everyone expects a little time to get going. Now, that doesn't mean to say that if you've had some reason that you really have been unable to participate in any academic work or very little academic work for some years you can't catch up. It's just going to take longer. So perhaps you were part-time for several years, perhaps you had childcare responsibilities, or you had some health issues, or you were very short-staffed in the department for a couple of years. You can still catch up. It's just going to take, a longer time to do it. All right, so this is sort of a natural break for me to take any questions before we move on to talking more specifically about different types of scholarly activity. So if anyone has any questions, you can probably the best way is to put them into the chat message, and I can just answer them now. Just give it a couple of minutes. All right, I see none, but feel free to put any in and we can come back to them. All right, so let's move on to those sort of three major areas that I talked about before. So research, teaching, and service. Again, as I said, I'm putting the clinical side of this aside for now. So educational research grants. So there aren't many national educational research grants around, but there certainly are educational research grants from our major radiological societies such as RSNA, Benkin-Ray, and AUR, and so on. So how does the promotions committee look at this? Well, they always like extramural funding, better than internal funding, but that doesn't mean it doesn't count. Perhaps your institution has some small pilot grant money that can just help you do a small project. You'll be surprised if you actually sort of reach out to a medical school or institution to find what's there that you may be able to get hold of. Governmental grants, as I said, yes, they're very prestigious, but there aren't many around. We don't have many industrial grants, but there are some from the major equipment manufacturers and certainly the societies, as I said. Now, how much does total funding count? Well, the funding really only counts if you are a PI or a co-PI, and nobody sort of adds it up, but, well, maybe they do add it up, but they do look at it such that, if you get a big grant, then that shows that, you are very respected nationally as an investigator to be able to do that. However, if you're perhaps 1% funding from somebody else's massive multi-million-dollar grant, as you're one of the sort of low-key players and you get some tiny fragment of your FDE, then it doesn't really matter, how much it is, because it's sort of not your prestige factor as such. It's obviously better to be the principal investigator than it is to be a co-principal or co-investigator, so that's worth bearing in mind. Educational research is important both on the individual level, so it's you doing the research, and also if it's team-based research. But what they do consider sort of as being not, very prestigious is what they call the cog in the wheel. So in other words, if perhaps one of the clinicians has some big grant that they're looking into some sort of a study that involves patients having CT scans to assess the response to treatment, and you just read these as part of your regular clinical reading of CT scans, then they don't really count that as much. Now, if you help develop the protocols and you help write the paper, then it does. So you'll be recognized, you have to be recognized for being a contributor in some way, and this might be a regional, national, or an international, but you have to very much be specific about what contribution you are doing. Now, the end result of most research, and there's going to be a whole another webinar that's going to talk about educational research, is to try and get things published, obviously. It doesn't have to be, excuse me, I'll step back a bit here, but it doesn't have to be a educational research paper necessary to get it published. Several of our journals will accept publications that are either reviews or position statements or curricula or short communications of how you do a specific thing. So really, and I know that I think Petra is going to be doing a session on this later on and give you some ideas of how you can turn what you're doing already into a paper without necessarily having to go out and do a double-blind randomized controlled trial. When they look at publications as part of the review process, they're going to look on peer-reviewed publications higher than non-peer-reviewed, and papers more than abstracts or electronic exhibits. Original research more than editorials or reviews. That doesn't mean these don't count. They just kind of count, a little bit less. Books more than chapters. Now, books I'll talk a little bit more in a moment. The quality of the journal is assessed usually by the impact factor, or they use some form of something called an H factor, assessing your productivity. And both paper and online journals count. Now, online journals vary markedly into their quality. I'm sure everybody here, like me, gets 10 offers a day to submit to online journals. So if you're going to do that, I would investigate those very carefully, because some of them are really considered as being complete throwaways, especially the ones you actually have to pay $3,000 to get your paper published by them. Review committees are aware of these. What about numbers of publications for promotion? Well, when we surveyed and we reviewed all these 30-odd APT committee documents, we only found one that actually mentioned a number. So there's vast times there's no set number. They sort of say, well, enough, which is really unhelpful if you're sort of paper counting on it. There is no question, however, that being first author or last senior author counts more than any of the other authorship positions. If you're going up to associate professor and being second author is pretty good, but being sixth or seventh author in a 10-author paper really, has a limited impact in terms of your portfolio. They do recognize team science to some degree. So, you see papers that have like 100 authors. But again, you have to show that although this is part of team science and the fact that you were 15th author out of 30, you do have to be able to say, yes, but, I had this key role in it. I developed this protocol, I did so and so. They also, importantly, it's not only the quantity of what you produce, but it is absolutely very much the quality of what you produce. They will look askance at people who have produced masses of abstracts, but perhaps only one or two of these have ever been turned into a paper. On the other hand, if you only have like one incredibly good paper and that's it, well, that's probably not, enough as well, and shows that you're sort of not being diverse enough in your scholarly output. You don't want to have tons of case reports and no real papers. Case reports, they're okay, but even as a clinician educator, you need to have a little bit more than that. What about books? Well, anyone who's written a book or even made a chapter knows how much work these are. Luckily, as clinician educators, they seem to count a lot more promotions committees than they do if you are going along one of the investigational pathways, which they seem to count very little. Even better, if you can show that that book or the chapter in that book is used as the standard resource by your institution, or even better, other institutions, then that kudos is really important, and it's going to be very important that you put that in your personal statement when you apply for publication. Now, many of us do stuff that is not really going to be a formal type publication. So how can we get it out there? Because I told you before that we need to be able to distribute our product for it, to fulfill these criteria of scholarly activity. So sometimes we're going to have to be a little bit creative about this. And so think a little bit broader about the term publication. The term publication just means the communication of information to the public, all right? There's nothing in there that sort of says the printing of this information in a hard copy journal that gets sent out in the mail. So when you're starting to think about developing some form of an educational resource or educational product, it helps if right up front, before you even do it, you start to ask yourself some questions that are going to help direct how you should get it out there. And the first one is there any way I can get this peer reviewed? Now, APT committees love things that are peer reviewed. It gives them extra stature. So can I get it peer reviewed? MedEd Portal, which is run by the AAMC, that I'm sure many of you are familiar with, is one way that you can get non-traditional resources peer-reviewed. Now, word of caution here, MedEd Portal has changed its criteria and standards for publication markedly in the last couple of years, and it used to be pretty easy to get things done, and you still can get things done, but because they are applying to have PubMed and Medline listings, which is going to be good because then your publications will be of higher stature, they have made things a lot more rigorous. So you now have to do pre and post testing and so on. So if you are thinking of potentially publishing something in MedEd Portal, I would recommend you look that all up now because it's a heck of a lot easier to do in advance than it is in retrospect, and I'm speaking from personal experience here. They do also have what they call the iCollaborative, and this is not peer-reviewed. So if this is something that you don't think is going to be suitable or it's kind of too late to be able to go under MedEd Portal, then consider using this. It still is, distributing it. You'll still be able to get usage statistics. The next question you need to ask yourself is, who is your audience for this resource? Is it going to be medical students, residents, fellows, faculty, other educators? Because that's going to affect how you distribute it. Is this a resource that's meant to teach somebody something, or is this a resource that other educators can use to teach? Again, it's going to affect how you're going to get stuff out there. Where is your audience? So not only where geographically is your audience, but perhaps your audience is limited to a society, such as, is it going to be medical student educators, in which case, going through AMSER in some means, or program directors going through APDR. Perhaps it's a subspecialist society, such as breast imagers, that getting something out through them may be better. Is there any way that you can get usage statistics? This is very helpful documentation to be able to give a promotions committee. And even if they're not asking for it now, this is something that they are going to be asking for, I strongly believe, at many institutions in the future. And it's so easy to obtain quite often. Sometimes all we can have is the number of hits to a page or number of visits to a page, and that can easily be obtained through Google Analytics. Or sometimes we can get something more like this, which we can get. Comes from MedEd Portal. You can also get the number of times that your paper has been downloaded from many of the major online journals and JCR, Academic Radiology, and so on. That can be helpful. And then, of course, citation indices you can get through Google and a number of other means. So to distribute your resources, perhaps you're just going to host them on a society website, such as the ACER, AMSER shared resources, or your institutional website, or even your departmental one, or a personal one. Just be aware that if you then try and publish something in a journal, and I'm speaking also from personal experience here, that some journals may consider the fact that you've had something on a website, any of these typical websites before, is counted as publication, and they don't want duplicate publications. I got into trouble with this one. Totally unaware, totally innocent. All right, so perhaps your resource is something that you can make into some very nice standalone module that you can put onto your institutional website, such as this. Think about how you can do that. Make it open access. So don't want to put these things behind a firewall. As soon as you put these things behind a firewall, you're limiting access. We're not selling them. So, make them as open access as possible. And so many institutions are now accepting that this is real scholarly activity. Perhaps do something that you can make into an app or a standalone program. And again, you'll be able to get download statistics from this. What about perhaps you've got a very nice video or a little podcast, and I think we're going to have a speaker who's going to talk more about this in one of the later sessions. Again, this is pretty low-hanging fruit that you can turn into some kind of a podcast or downloadable product. I have a YouTube channel, and I've started putting more and more stuff up there. It's just a couple of little things I've put up here. And, is this a paper in Nature? No, but 20,000 odd people have watched this 8-minute video. I mean, if I'd put a couple of cats and a dog in, I'd have had 2.5 million, but, you know, I remember that next time. But still, you know, how would I ever reach an audience of 20,000 people by going and giving this lecture at a national meeting? So think about it. You know, if there's some other means of doing it, okay, maybe not. But if there's nothing else, get it out there. All right, let's talk about specific teaching. So all types of teaching count. So any type of formal course learners, but also bedside, or in our case, PAC-side teaching counts. And so when you put in your promotion application, you try and estimate how many hours you've spent with a resident or student sitting beside you. And it's usually hundreds, if not thousands of hours a year. And this does absolutely count. If you can get to be an invited speaker, either a visiting professor or on a CME course or at a society, it's very important. And that is either regional or national prestige. The more out there you can get, national versus regional versus institution versus in your department, again, incrementally is more prestigious. One of the things you have to do is you've got to document it. So you've got to document your teaching. What did you teach? Who did you teach it to? How much? You know, was it a 5-minute talk or was it a 3-hour workshop? What kind of format was it? Was this didactic teaching or was this more hands-on complex workshops? And then you need to collect those evaluations. That's very important. We'll come back to that in a minute. If you have developed any kind of a curricula, then document that. And people often forget that they've developed curricula. They think, oh, I've never developed curricula. And then you say to them, but didn't you develop the whole resident curricula for cardiac imaging? And they say, oh, yeah, I did. So, you know, document that. And when you document, you want to document, you know, how many years has this curricula been in use? You know, estimate how many people have used this curricula. If you can get this curricula adopted by other institutions, has it been cited in any papers? You know, we developed the AMSER curriculum many, many years ago, and, you know, that's now been cited a large number of times. What about writing exams or writing questions for exams? This is another scholarly activity. There are a number of different venues for this. Local ones, you may have many of the societies or national. So the ABR is always looking for question writers, as is ACER. Rankin Ray has some. NBME, I worked for several years doing this. But two of the things to think about is there any peer review? Again, peer review counts. So if your questions, when you write a question for the ABR and the ACR, somebody else is reviewing your questions. And then the impact or the distribution. So how many people are using these questions? Is it national or is it just your department? I'm going to, of course, put in a plug for RADexam here, so forgive me. For those of you who don't know about RADexam, drop me an email later. This is coming to you all in about 3 weeks. And the writing questions for RADexam, these are peer-reviewed, they're nationally distributed, and you will have usage statistics. We also send out from the APDR and the ACR, because this is a collaboration, certificates once a year. So we have different levels of certificates for both editors and authors. So you have documentation to flash in front of both your chair and add to your portfolio. What about mentorship? Well, mentorship is not every resident that you taught. So APT committees do look at mentorship. What they want are true mentoring relationships that last over time. So, you know, when we see a list of, 30 residents, we're pretty dubious about the real mentoring. And you need to be able to document positive outcomes. So perhaps you mentored a resident in a research project, or perhaps you mentored a fellow who's going into your career specialty, and you can show that, they're now out there and they're this great sort of academic radiologist and so on. Or that you've mentored medical students who have gone into radiology. Evaluations. So they look very carefully at evaluations. In fact, this was sort of the #1 thing that we found that promotions committees were interested in clinician-educators. They want evaluations from all levels of groups. So the students, the residents, the CME courses and so on, and they're interested in both the quantitative evaluation, so that you got 4.2 out of 5, as well as the comments. This is really important. you need to keep these. This is nobody else's job to keep it. You need to keep these. I get people, I mean, I've been the student elective director for 20 years, and I get people saying, oh, can you give me my last 20 years of student evaluations? And the answer is no. You know, I don't have a filing cabinet that big to keep all this stuff. So when people send them to you, you need to keep them. That's what I said, you know, so you get them sent out from CME courses you've taught or anything else, and people say, oh yeah, let's look at them, say, oh yeah, that's great, I didn't suck, or more likely you focus on the one negative comment there and ignore the great comments. File these somewhere. You also, I highly recommend that you track specific learners, so ones you've had mentoring relationships with, for example, because many institutions, including my own, ask for specific evaluations from these learners. So we have to have 10 learner evaluations of, this could be residents or students or fellows, submitted. So we have to actually send them a letter, we have to contact them by email and say, will you write this evaluation to a standardized form about Dr. So-and-so. And so if you are able, and you're able to give names, that makes it an awful lot easier. All right, let's move on to talking about the third category, which is engagement or service. And engagement and service can absolutely be in the educational arena. And again, in terms of kudos, national is better than regional, which is better than institutional. We always have to list our membership in national societies, but, you know, let's face it, you've just got to pay a fee. You sort of don't have to do much else for that. But all of these societies have committees which you can apply to. And as I've said here, you know, being on any of these committees, it's better if you're on a national committee than you're just on a departmental committee, but all of them count. If you're a chair, it's better than being an officer, which is better than being a member. So look to be able to rise up in the ranks of these committees. But you do have to be able to describe your product. So you need to be able to say, what did this committee do and what did I contribute to it? So just sort of a checklist, oh yeah, I've signed up for 6 committees and then you never do anything, you know, has limited impact. Locally, you can certainly do a lot. You know, obviously you can be a program director, and program directors are considered very important for educational scholars, but you can also be an assistant or an associate PD. There are many education committees within your department, such as the CCC or the PET committee you can belong to, or the interview committee. And then for students, being a clerkship director or a co-director, or being a leader of radiology interest groups, are all ways you can provide educational service. If you want to look a little broader, most promotions come from the medical schools, so they look very positively at medical school committees. Now, some of these, like the admissions committee, can be an awful lot of work, so don't sign up unless you've talked to somebody who's been on one. Educational related committees are present at all of our institutions, all of our societies. So if you go to AUR or Rankin-Ray or RSNA, you'll find that there are some committees that you could potentially be on. There are also potential for developing national curriculums, being a program chair for one of the sections of a committee or a CME course, and then being either an examiner, such as for the ABR, or an exam developer, as I talked about before. These are all educational national service. So look at these committees and see, look at these societies and see what you might possibly be interested in. But you're going to have to put yourself forward. You know, you can't kind of sit around and say, wow, I wonder why nobody's contacted me to see if I can be on the committee for the APDR because I'm such a great program director here. Well, that's sort of not how it works. On the other hand, it's really easy to get on these committees. You drop an email to the chair of committee and you say that you're really interested in it and will they consider you for membership? And most will say yes, or they might say, you know, we're full at the moment, but I'll keep your name for next year. You also need to network, and network at your national meetings. Here are a couple of people who might be recognizable to you. Networking hard at an AUR cocktail party. This is where you make your contacts. You know, at the RSNA, at the AUR, at Rankin-Ray, talking to other educators. They say that they're doing something. You say, wow, that sounds really interesting. How can I be involved? Well, they say, oh, I'm the chair of the AMSER curriculum committee. And you say, oh, what do you do? How can I be involved? and then follow up with them. Don't expect them to follow up with you. You follow up with them. Ask for their card, drop them an email later. Use your contacts wherever you can. Drop an email to some friends. You have to kind of, sell yourself, and that's not so easy. So if you know anybody at another institution and you have a really fabulous talk on breast MR, drop them an email. Ask if they're interested in having a visiting professor in this area. Send them an example of your talk, or send them somebody's name who's heard you talk. We often don't want to take people blind. Same for meeting moderations and speakers. Contact the program chair for the AUR and tell them, or for APDR, and say you're really interested in talking. Give them some ideas of the sort of subjects that you can talk about. Academic radiology and JCR, always looking for journal reviewers. That's easy to reach out to them. Committee membership and examination boards I talked about before. Reach out to these people. Okay, and I move on to my final section, which is documentation. Here's the news. We have to track all of these things. So you have to keep track of all of the stuff that you do in the educational arena that covers anything you're doing. And this is why we forget it. You won't remember. I promise you, you will not remember in 4 years' time when you come to put your educational portfolio together everything that you have done. So track it as you go along. You can track it in different ways. This is a snapshot from an educational portfolio. There is a blank on the ACER website, the AUR ACER website. You can go to it and you can download one and modify it. Some promotions committees require it, many don't, but even if they're not requiring it, you may submit it as an addendum, or if nothing else, it will help you keep track of these kind of things. Now you can perhaps just toss everything into a bunch of folders in your file cabinet. It's certainly better than nothing else, or a digital equivalent of this. We have a scholarly and service activity database, which is web-based at my institution, which we put all of this stuff into. This is exportable to other institutions, so if you're interested, just drop me an email. And then keep your CV up to date. It's so much easier to put stuff in as you do it than it is to do this retrospectively. And when you keep your CV up to date, make sure you're using the format your institution is using. They're often extremely specific, and if you don't use the correct format, you're often missing out categories, and it's difficult for people to evaluate you, and it's a pain in the butt to do later. It's much easier when you don't have much to go in. So my final tips, and then there's a couple of questions coming through I'm going to look at, is start to develop some kind of a plan, but remain flexible. Find good mentors who can help you in this process, either locally, nationally, or elsewhere in your institution. Network. Networking is so important, I can't tell you. Most of my big educational opportunities have just sort of fallen into my lap, usually over gin and tonic at the AUR cocktail party, but network. Go on some educational courses to give you some more ideas. Really try and distribute or write about what you've done. Look at what you've done and see how you can get it out there, and some other sessions later on again to talk more about that. And then I can't emphasize enough, the moment you've done anything, record it in some form, as I've suggested before. So I'm just going to see, there's I think a question or two here. There's one question here, and then we'll also take off all of the mics, the muting. So somebody's asked them, you mentioned the importance of mentorship, not only for helping you get promoted, but also helping you converting your teaching into scholarship. For those of us who are unable to find someone at our own institution, what's the process in which we could identify a mentor through AUR? So the AUR has a annual mentorship program, which they send out something usually a month or two before the AUR, which people can apply to. But the other way to do it is I would drop an email to the chair of ACER or the chair of AMSER, depending on, or APDR, depending on which organization you feel more affiliated with for your particular education, and just ask them. And we know a lot of people, and that they can direct you accordingly. As I say, ACER doesn't have to be sort of sitting in the office. Your mentor doesn't have to be sitting in the office next to you. So, Carrie, can you just unmute everyone, and then anyone who wants to ask a question can do it? I may regret doing that. But.
Everyone's been unmuted.
Okay, anyone who wants to ask a question? I think I've got a lot of noise in the background. Okay, so I'm going to do this. So mute everybody again because it's okay. And then anyone who wants to ask a question, please enter in the chat window. No? Well, this is being this has been recorded, and we will be posting this on the ACER website. So if anyone has any questions, they just want to email me here. Let me put my email address up here. Here's my email address, easy to remember, petra.lewis@hitchcock.org. I am more than happy to answer people's emails specifically offline. And I am returning 3 minutes to your day. Thank you very much, everyone, for attending.